Hi, everyone. Thank you so much for joining us today. My name is Andrea Fabilaron, and I am one of the college program coordinators at California Youth Advocacy Network. Welcome to today's webinar, Supporting Students in Quitting Tobacco During COVID-19, Resources and Recommendations. Today, we'll be going over young adult tobacco use, available resources for encouraging and supporting young people in quitting tobacco, and ideas for supporting college students virtually in their cessation efforts during the COVID-19 pandemic. Some housekeeping rules. This webinar will be recorded and made available on our website. Please utilize the chat box for any questions that you might have during the webinar. We will have a Q&A section at the end to address any questions or comments that you guys have throughout. For those of you who aren't familiar with California Youth Advocacy Network, or CYAN, we are a statewide agency offering technical assistance. We work with you all on the local level to engage youth and young adults to do tobacco control advocacy. We are fully funded by the California Department of Public Health Tobacco Control Program. We have 3 programs. Our youth program focuses on youth engagement to impact local policy change. Our college program works directly with college and university campuses to support the adoption, implementation, and enforcement of smoke and tobacco-free policies, as well as encouraging and supporting young people to quit. We also work with military partners in efforts to change the norm of tobacco use in military populations, helping our installations and veterans clinics in the state with their prevention and treatment programs. CYAN offers support through technical assistance, trainings, statewide leadership opportunities for youth and young adults, system-wide advocacy campaigns, and opportunities for networking. Webinar overview. With the COVID-19 pandemic and transition from in-person to virtual learning for students, we're going to go over young adult tobacco use, the health risks and COVID-19 for those who are smoking and vaping, and discuss what tobacco use could look like for college students during this time of sheltering in place. We will look at how to encourage and support quit attempts during this time of physical distancing, including use of social media for messaging and available resources for quitting. We will also discuss ways that campus health centers and staff can support students in their quit attempts virtually and hear how some campuses in our state are providing cessation services during this time. Lastly, we will go over recommendations from CYAN about providing cessation support to students during the COVID-19 pandemic. First, let's take a look at young adult tobacco use. Why do we focus on young people? It's important to understand tobacco use behaviors so we know how to talk to young people about it and to set up the foundation for cessation messaging. So what do we know about youth and young adult use behavior? Well, we're seeing a shift from non-daily use to daily use. Historically, we saw that youth and young adults were not typically daily tobacco users, but rather more social users. However, this is beginning to shift with the increase in youth vaping. We know that addiction establishment happens by age 25. We also know that dual use is common with young people, with e-cigarettes being the most commonly reported product used in combination with other tobacco products. We also know that young people like flavored products, which mask the harshness of the tobacco or nicotine, and that a large portion of young people start with a flavored product. In comparison with general adult use, we see that older adults smoke more daily, or their use is more daily. They tend to have a longer addiction. They are less likely to use flavored products, and it's more difficult for them to quit. First, let's take a look at data from the National Youth Tobacco Survey. While the data on the next few slides are youth-specific, it's important to note the upward trend of e-cigarette use among young people, especially since some of these youth have since entered college or may be incoming college freshmen in years to come. National data shows that e-cigarettes are the most commonly used product among youth since 2014. The highest rate of e-cigarette use was in 2015, with a decrease in 2016 and a slight uptick since 2017. However, in 2018, we started to see a surge in youth current e-cigarette use. While current combustible cigarette use has dropped, we see current e-cigarette use has increased dramatically, especially throughout the past few years. Data from the 2019 National Youth Tobacco Survey shows a significant increase of e-cigarette use among youth between 2018 and 2019. Nearly 1 million use the product daily, with about 1.6 million using the product frequently on about 20 days or more during the month. Juul was reported by the majority of youth as their usual brand. Now moving on to young adult tobacco use rates. From 2014 to 2018, the percentage of young adults aged 18 to 24 who currently smoke cigarettes decreased from 16.7% to 7.8%. The percentage of adults in this age group who currently use electronic cigarettes increased from 5.1% to 7.6%. Like youth, young adults use e-cigarettes at the highest rates and saw increases in the frequency of use when compared to older adults. Frequent and/or daily use in particular has nearly tripled in 5 years among this group. We are seeing an increase in both nicotine vaping and marijuana vaping among college students. Past month nicotine vaping for college students ages 19 through 22 more than doubled from 2017 to 2018, with an increase from 6.1% to 15.5%. This jump is the greatest one-year increase seen for any substance in the history of the survey. Meanwhile, we saw nicotine vaping among young adults not in college increase from 7.9% to 12.5%. With marijuana vaping, we also saw a jump that doubled among college students, with an increase from 5.2% to 10.9%. Meanwhile, there was no change among young adults not in college. When we look at use in California, we see that cigarette use continues to decline, while e-cigarette use and marijuana use continue to climb. Furthermore, of young adult tobacco users, 57.7% use a flavored tobacco product. Cigarette, e-cigarette, and hookah are the three dominant tobacco products used by young adults. College attendance may reduce young adult cigarette smoking, but may not reduce using other tobacco products. We see this with products like e-cigarettes and hookah. Why young people vape? They may vape because their friends or family members use them. We also know that flavors are a factor as they mask the harshness of the tobacco and nicotine and appeal to many young people. And there's also the belief that e-cigarettes are less harmful than combustible cigarettes. Now let's take a look at how COVID-19 can affect people who smoke and vape if infected. So why focus on tobacco use during COVID-19? We know that COVID-19 attacks the lungs. We also know that smoking and vaping harms the lungs and the immune system, which affects the body's ability to fight infections. This puts tobacco users at greater risk for severe COVID-19 symptoms if they're infected. We know that smoking and vaping are associated with an inflammatory process in the lining of the lungs, which is the very place that COVID-19 causes its most serious damage. There is also growing evidence that the aerosol from vaping can harm lungs at the cellular and organ levels and worsen the body's ability to fight respiratory infections. Tobacco use remains a leading cause of preventable death and disease. Smoking and vaping are avoidable risk factors that may contribute to poor health and more severe symptoms with a COVID-19 infection. Although there's an increased risk of severe symptoms for COVID-19 with smoking and vaping, why would young people use tobacco during this time? There's this feeling of being invincible among young people, a thought of, that won't happen to me, I'm young and healthy. This may make it difficult to understand the long-term consequences of tobacco use. Knowing the risks and health effects are important, but stress, boredom, and self-isolation are factors to consider when looking at young adult tobacco use. Let's discuss how sheltering in place and physical distancing may affect college students who use tobacco. We're currently living in a time where there's a lot of changes and transitions that everyone's had to deal with in many aspects of life due to COVID-19, as well as uncertainty about how and when we'll return to normalcy or some part of it. Shelter in place can bring up a lot of different emotions, including stress, boredom, and self-isolation. It's also important to note that on top of all of this, college students are entering another period of high stress, finals. One study found that there were multiple functions served by smoking for college students, particularly during finals week. Smoking helped in alleviating stress or coping with anticipated stress. It was a means of taking a study break or refocusing by allowing a shorter break compared to longer breaks like going out to eat with friends. Smoking also helped deal with states of boredom. Free time from not having any more classes, coupled with studying, left students feeling bored. Almost half of low-level smokers reported that their smoking increased during finals, mostly out of boredom. There's also this need for socializing, and smoking allowed a way for students to catch up with friends or to socialize after long periods of studying. It was also a means for empathetic smoking and relieving secondhand stress. Smoking can serve as an idiom of distress, signaling non-verbally to friends that you were feeling stressed. Smoking allowed Smoking was a means of allowing someone to smoke to help support a friend if they were feeling stress, or even to relieve secondhand stress if their friend's stress became their own. Lastly, smoking was a way of celebrating or rekeying after studying. It was a means of transitioning from studying to being social. This can be compared to how working adults grab a drink after working. Now that we've gone over how stress and boredom from sheltering in place during COVID-19 may affect tobacco use behaviors, let's dive into young adults and cessation so we can understand young adult quitting. We know that quitting tobacco is hard due to physical addiction, behavior addiction, and emotional connection and/or stress. Most tobacco users want to quit, about 70% of users. Young adults have the highest quit attempt rate, which is why encouraging and supporting young people in quitting is so crucial. People have been successfully quitting tobacco for decades, and there are proven best practices for supporting quit attempts. Young adults are more likely to quit without assistance, such as medical support and pharmacotherapy. College students might not think they're addicted. They may not have tried to quit before, so they might not know how addicted they really are. Maybe they didn't consider their tobacco use to be a problem because they're social users or non-daily users. This affects their quit attempts or lack of quit attempts. Young adults respond to mass media promotion. College students tend not to like groups, so individual counseling seems to be preferred. They might not be able to afford medications. In some cases where this is true, how can we support them? In other cases, we can discuss how they used to be able to afford tobacco products and that medication is temporary. Young adults want interventions to be relevant to young adults, respect their individual choices, and highlight positive aspects of quitting. The American College Health Association recommends colleges and universities offer the following: screenings for tobacco use and health services, free or reduced cost tobacco treatment counseling, free or reduced cost nicotine replacement therapies or NRTs, medication options on campus or nearby, inclusion of tobacco products, medications, and services in student health insurance plans. Next, my colleague Caitlin will go over digital messaging, encouraging quit attempts during COVID-19, and resources that are currently available for supporting young people in quitting.
Hi, everyone. We are in the office today and practicing social distancing, so you probably just heard our chairs do a little dance there. As Andrea said, my name is Caitlin Maisman, and I am the outreach coordinator here at CYAN. I'm going to be sharing really how we have leveraged technology and social media in new ways to adapt to these challenges that we're hearing from campus partners as we've all transitioned to working remotely and to distance learning. All of the resources that I'm going to be discussing today are available to you, and that would either be on the CYAN website or from statewide and national partners. So I'm sure it's no surprise that one of our biggest tools right now is social media. This is really a powerful tool to utilize, especially now, to connect with young adults and students. Youth and young adults are continuing to engage, are continuing to engage with social media, and so we really want to use social media strategically and to place these resources in areas where and on sites where we know young adults will see them and feel motivated and encouraged to try a quit attempt. With that in mind, we worked with our youth board and our COF student board of directors to develop a social media campaign that felt relevant and engaging and would really speak to those unique challenges that we're facing right now. And what we came across very strongly, and what we heard from youth and young adults, was that the message really matters. And Andrea really touched upon these three things, but the sort of trends that we heard from youth and young adults really fell into three main themes. And that is how to cope with anxiety and stress right now without tobacco, how to address the feelings of loneliness as a result of sheltering in place and social distancing, and how to manage the boredom. Lots of young people have significantly more free time or at home, and how to fill that time without tobacco. And what kept coming up was really this idea and this resounding message of what's going to help me cope right now, not next week, not tomorrow. There was this sort of feeling of right now was the need. And so we took those three messages and developed a social media campaign specifically for our youth and young adult audiences. There's 3 slides up there that you can see that on the screen in a little blurb. And the campaign has 18 unique posts to help youth and young adults manage stress, boredom, and loneliness without tobacco. So these have been placed on our Instagram, Facebook, and Twitter very newly as of Monday, and these will run through the end of June. The campaign has gotten a lot of momentum. We're extremely excited about it. For example, the 3 posts that we placed on Instagram on Monday have over 700 likes already, which really tells us that these are messages that resonate with youth and young adults right now. And this is a time when they really need them most. And again, keep in mind, typically we see maybe 10, maybe 20 likes per image. So to have, you know, that much momentum and leverage is really incredible for us. I do want to mention that all 18 of these posts are available for you to download and use, and you can access those directly from our CYANonline.org website. So, you know, if you have social media, if you've got an Instagram or a Facebook, by all means, we encourage you to look through those and to place those on your platforms. And then here are a few more of the posts. Again, there's 18 unique posts in total, and each one either offers a tip or a tool for youth and young adults to manage their tobacco triggers. And we have really exciting hashtags like find something new or don't vape meditate, which is one of my favorites, and that actually came from one of our COF board members. And the feeling of these posts are really positive. They feel warm, they look like real young people, and they feel relatable. And that was intentional. We tested these images with not only our youth board and our COF board, but also with youth and young adults across the state. And they tested extremely well. And several of them mentioned that these felt very different from traditional anti-vaping and anti-tobacco campaigns, that they weren't corny, they weren't doom and gloom. It wasn't another thing to feel scared about right now, and that they felt accessible. And so what was really exciting as well was that the majority of these youth and young adults throughout the state said that they would engage with these posts while they are scrolling. And we're seeing that with the number of likes that we've had so far. And then I do want to call out that all of these posts have a call to action, if you will, and we direct the reader to CYANonline.org/quit tobacco, which is another new resource for you. So this is our new webpage. It is available in both English and Spanish. And it has information on the risks of vaping, tips for quitting, and a list of free and anonymous apps and resources for young people. And then this information from the web page is also available as a print resource. We currently have this in three different forms. We have it as a flyer, which you'll see there, a trifold brochure in the middle, which is actually the size of an iPhone. We hear a lot from youth and young adults that they don't want another brochure and that they're not cool, and we love brochures in public health. So we worked with our designer, and based on the feedback that we heard in our focus groups, to kind of shrink this down. So this is actually the size of an iPhone that can easily be slid into a pocket. And then the final format there is the fact card on the right. And again, these are all downloadable on our website. You are welcome to access them and distribute them. And I do want to make note that we have these in both English and Spanish, and we will begin to distribute these via mail when it is safe for us to be back in the office. So for now, the content is downloadable for you. And then I did just want to quickly take a minute to briefly review the 4 resources that we have listed on the Know the Risk material and also on our webpage, and just kind of give you an idea of how your students and how young people will interact with these if you are referring to them. There on the left is the California Smokers Hotline, or the 1-800-NO-BUTS. I would assume most of you are familiar with this. We know young people are not very likely to call a hotline, but I do think it's really important to call out that there is counseling available in 6 languages, and also that the hotline does offer free NRTs that can be sent directly to the caller's home. And if someone is not comfortable calling, they do now have a text support option. On the right there is No Vape. This is also part of the California Smokers Hotline. And it is geared specifically to youth and young adults who want to quit vaping. And this program is a website, it's a free app, it's a helpline, and there's also a tech support where a young person can work to create a quit plan. And we find as well that if you are referring to these and you are using these resources, that youth and young adults and students really like to have free and anonymous stressed with resources. And so all of these that we'll talk about today are that. The next resource here is the This Is Quitting app and text. This is, again, like its name says, a free app and texting service. It really is geared to help begin a quit attempt, and really sort of works to suit those who are kind of in pre-contemplation as well. It has a feature for you if you're not quite ready to commit to quitting yet, to work to build support and confidence that when you are ready to take that step, you have a plan in place. This is part of the Truth Initiative, and this is an app that has access for the user to speak with or interact with a counselor 24/7. The next resource here is the Quit Start app, and this is through smokefree.gov, and it offers a free app with tips and tools to manage triggers. And what's important, I think, to call out with this resource is that it's really interactive. So there's games and there's badges you can earn, you can track progress, you can share milestones on social media. So really think about, you know, what types of apps are going to be the strongest resource for your students or for those that you are servicing through your health center. This is a great one for someone who maybe wants more engagement or interaction again with those games. And then the final resource here is Smoke-Free Text, which is also part of smokefree.gov. And like its name says, this is a texting service. And this sends daily messages over the course of 6 to 8 weeks. And it does also have a texting service that is specifically for teens and also for smokeless tobacco users. I would say it is important if you are using this as a referral or a resource for someone to kind of set the expectation that you will get 3 to 5 text messages a day. I signed up myself just to have an idea of what someone would be getting when they receive these text messages, and actually had to uninstall it because they were so frequent. So, really being mindful of that and setting that expectation on the front end, I think, is important with this resource. And then I do just want to take a minute to mention a few resources you probably are familiar with. These aren't new, but these may be helpful now. This is our Methods to Quit Tobacco brochure, which we created specifically for young adults in California. This has resources and information on free services like counseling and texting programs, and again, those apps that we just reviewed. This is available for a free download on our website. And again, when we are able to, this is something that we will ship to. And then finally are our 2 military materials. We've got 2 brochures. The first one there on the left is our veteran resource brochure, and the one on the right is our military or active duty brochure. And again, all of these 3 brochures, along with the materials we just reviewed and the social media posts, are all available for download on our website. And again, once we are able to safely be in the office, you can request these be sent to you.
Thank you, Caitlin, for sharing the different resources that we can provide to young adults during this time while if they're trying to quit tobacco. With all of the changes in our daily lives due to COVID-19, we've had to make adjustments to some of the ways we support the populations that we work with. A huge part of that is finding ways to support students virtually while we stay at home and shelter in place. Let's take a look at some examples of how campuses in our state are working to support students during COVID-19. I'd like to introduce our first guest speaker, or our guest speaker for the webinar, Rachel Alvarez, who will be sharing with us some of the exciting ways that Sacramento State University is supporting students in their cessation efforts during this time.
Can everybody hear me real quick?
Yeah, we can hear you fine, Rachel.
Awesome, perfect. Thank you so much. All right, so yes, thank you so much, Andrea, for that quick intro. I'll further introduce myself. My name is Rachel Alvarez. I use the pronouns she, her, and hers, and I am the health educator for alcohol, tobacco, and other drugs at Sac State. I've been with Sac State for about 1.5 years now, and I'm really excited to share some of the things that we're doing. Obviously, I'm sure y'all have seen everything that's been happening in the news regarding the CSU system, so we did just find out within the last couple of days that a majority of our classes for the fall semester are going to be online. And so that really not only changed how we're approaching the summer and how we approach the rest of the spring semester, but really how we're going to approach the fall and potentially moving into the spring as we slowly start to reintegrate onto campus. So next slide, please, Andrea. Thank you so much. Okay, so first and foremost, I just want to give you a little bit of an idea of what's still available on the Sac State campus. I'm aware that campuses are operating differently. Some of us have different resources, more or less personnel and things like that. So I just want to give you a clear picture of kind of what we're working with that has allowed us to be able to continue reaching students in the best way possible. So first and foremost, our medical and our counseling services are still available to students. Campus is technically open, although a majority of us are working off-site. So we have medical and counseling personnel available both in person and remotely. So doing quite a few telehealth connections with students still, doing phone calls, Zoom, all of the above. Really in an effort to continue having these dialogues with students about their physical and their mental well-being and their physical and mental health. Our pharmacy is also still open. their services are available in person. So in order for a student to come into our health center at this point, we are screening them as they come through the door. So they'll just have their temperature taken real quick. If they have a fever or exhibiting any symptoms, of potentially COVID, then they will be taken to a separate room. But if they just are coming in to get, prescription or want to engage with pharmacy services, then they absolutely can do so. So our pharmacy is really amazing. Our lead pharmacist, Jana Dumonchel, is fantastic. She has a psychology background, so she really knows how to talk to students and how to reach students, aside from just filling prescriptions. So in our pharmacy is where we actually distribute our quick kits. One thing I do want to mention is right now our quick kits are primarily used for tobacco use, although students, when they hear quick kits, they think that they're able to be used for both tobacco and for marijuana. And so as of this coming fall, we are going to be modifying our quick kits to be both marijuana and tobacco friendly. So what that's going to look like is I'm working with my team of students right now, and we are going to incorporate some other ingredients in the quick kits, like, for example, green tea, which, we know has antioxidants and can help, with some physical healing, but it has a little bit of caffeine, and, that might help bring students out of some of the sluggishness of marijuana, and also help in their attempt to quit tobacco as well. What that's also going to do, too, is tackle both marijuana and tobacco at the same time for students that are co-using these substances. So I talk to a lot of students on a regular basis, and many of them do use blunt wrappers to use their marijuana products. So they're getting both nicotine and marijuana. So this is really, hopefully going to kind of further the scope of who thinks that a quick kit would be, accessible to them, and who thinks that a quick kit would be helpful to them. So that is something that's coming in the fall, and I'm happy to connect with folks after the call if y'all are interested in learning in exactly what we're going to be putting in those quick kits. So we are still distributing quick kits at this time in the pharmacy physically. I was just in the office yesterday and packing up quick kits with gloves on and the whole thing, so that they were sterile and good to go for students. I also want to point out that our pharmacy offers low-cost NRTs, and the quick kits do contain a sample of the nicotine gum, and there's some other options available for students in the pharmacy, but our pharmacy in general has very, very low-cost products, including things like ibuprofen and stuff like that, which as they're quitting tobacco and quitting nicotine, they will be able to kind of mitigate some of those symptoms that we expect when they're quitting tobacco. Also, Health and Wellness Promotion Department, which is the part of the Student Health and Counseling Services that I am part of, is available remotely. So they have me at their disposal. I don't get a lot of individual student referrals, just to be honest. Most students, when they come in for their quit kit or they come in, for their quit aids, their NRTs, they don't really want to sit down and have a conversation so much. But I have had some students that have requested resources via email. So I make sure that I have an email drafted up that's ready to go out to a student if they do want those additional resources, and just knowing that they have some support and that there is somebody on campus that specializes in that, I think is helpful for them in their quit journey. And then, really being able to give them connections to those community partners and external resources is very important. All right, next slide, please. Okay, so tobacco cessation promotion. Obviously, this has changed quite a bit with us moving virtually. We did have quite a few in-person events still on Sac State's campus. Not every campus does do as many outreach events, but it's just something about Sacramento State's campus where they absolutely love outreach events, physical outreach events, where we can get out there and talk to folks. With, a majority of students being off campus, there actually is still close to 300 to 400 students on campus in campus housing, whether that's because they are homeless or maybe they're international. We do actually still have quite a few students on campus, but the way that we're reaching those students is still very much electronic and very much through social media. So social media, very popular. There's so many routes and avenues to reach students that I think one of the most important things as we entered this was really deciding which social media platforms we were going to focus on. We could create an account on every single social media platform, but if we only posted to one or two here and there, then those should probably be what we focus on, as opposed to having all these different accounts and then they're not active and students aren't going to interact with them anyways. So frequent posting does emphasize a healthy campus culture, and I cannot state that enough. The more like positive imagery you have, bright colors, those types of things, you're really promoting the healthy ideal. And I really, really absolutely just want to put in, you know, congratulations for those new youth and young adult social media campaign graphics. They are so fantastic. I can't wait to use them on our platforms. You know, I love the imagery. You know, there wasn't scare tactics used, things like that. I love that there was people of color. I think that that's something that had been missing. So really being able to reach our wide demographic is so important. I also wanted to highlight with tobacco cessation promotion that you can loop tobacco use or substance use into almost anything. And I have, as the ATOD coordinator, you know, I'm fighting for spots on our social media with our other coordinators, Healthy Relationships and, you know, Active Minds, which is our mental health cohort and our nutrition cohort and stuff like that. And some of those other topics can be a little bit more, for lack of better words, a little bit more sexy than the alcohol, tobacco, and other drug topics. So finding a way to partner with other health initiatives is so, so, so critical in this work, and it's so critical for reaching students. So one example that I want to bring up is May is Mental Health Awareness Month. Right now, people's mental health is suffering, and like the other presenters mentioned, you know, students are looking for coping mechanisms right now. They're feeling extremely stressed. Like now may not be the time that they are thinking that they want to quit, but it could be a really good time if they are able to see, oh, some mental health messaging mixed with some ATOD messaging. Oh, okay, you know, maybe I should, you know, consider quitting because it's actually not helping my mental health, you know, during this time and things like that. So really just wanted to highlight that piece of that collaboration with other health topics, so important. Making sure to update services as they become available again or go away is so critical on social media. You know, we have students reaching out in our DMs all the time asking if they still can come into the pharmacy and not. And unless you're posting about your offerings and what's available frequently, they're not as likely to reach out. You know, some students don't mind sending a DM, some students don't mind commenting on a post, but really very much it's about making sure that you're posting frequently about what's available to them on campus and off to, you know, just show them over and over again, like, you are not alone, we are here, there's services available for you. And then lastly, just, you know, for all of our sanity, remember that this is a super high stress time, not only for us, but for our students. Stress intensifies cravings. It makes it harder to quit and stuff like that. So please, you know, just take it, you know, as it is, take it with a grain of salt, and, you know, just continue plugging away at tobacco cessation because you never know who you're going to reach. Next slide, please, Andrea. Awesome, thank you so much. So at this point, I just want to show you a few of our social media posts to just give you a little bit of an idea of some of the postings we have done and the postings we are going to do in the future, because I do think it is important, you know, all of those themes that I talked about to really show you real time what that's looking like for us. So if you're not already following our social media, I highly encourage you to. Our handle is at SHCS Sac State, and that is for both Instagram and for Facebook. So this was a post that we did for Earth Day. And again, like Earth Day, very broad. You can take Earth Day in any direction. You can talk about the general environment. You can talk about water. You can talk about whatever you want. But I claimed that on that day for tobacco use. So it talked about, you know, the environment and how cigarette, you know, waste is considered toxic. Hashtags are very, very important. Make sure you put relevant hashtags. I recommend putting some space so you can kind of see like the posting language is spaced out from the hashtags. That will make it so that they see the posting language and not this like giant list of hashtags. Students don't tend to like that very much. Use of emojis is very important. And then using these beautiful images, again, very, very similar to some of the social media postings that were shown earlier in this presentation from the new social media campaign. They're light. It's bright, it's airy, it's relatable. This is our Guy West Bridge, which goes onto campus. Like everybody who goes to Sac State knows this bridge, and it's a favorite around campus. So really just looping in this positive imagery, getting a little bit of health education in there, and tying it to a day that everybody knows about and cares about is really how we were able to reach a bunch of folks. Go ahead and hit the next slide, please, Andrea. Thank you. This was a story post that we had done in conjunction on Earth Day. So I'm not sure, some of you probably read through the entire description, but I had said, please refer to our story so that, you can learn some ways to properly dispose of. So this was adapted from a Cal Recycle infographic that was sent out from a previous CYAN webinar that I attended. So thank you very much for providing that. So we used the platform Canva, for those of you that are aware of Canva, and we really just created something that was fun and light and bright. Again, just trying to get the message across that there's small things that folks can do, in changing the way that they throw away their tobacco waste. But that's also getting them to think about their tobacco use in the first place and kind of their social responsibility. So it's tying that in as well. And then one thing I did want to mention is the original post said, check out our story, but I did go back and change the language to say, look in our highlights. So these graphics are now in a highlight on our Instagram under the ATOD, which is alcohol, tobacco, and other drugs bubble. So if you are putting stuff in your story, obviously the story only lasts for 24 hours. It's going to go away. So just make sure you go back and change that to like, oh, we saved it in our highlight. And so that they can refer to that, because if somebody does go back and look at that post, it's no longer going to be in the story, and they're really just going to miss out on that information. Next slide, please, Andrea. Okay, so this is the last little bit before I kind of wrap up. I wanted to give you a little sneak peek of an idea that you all can use on your various social media platforms to reach your students. So coming up on the 31st of this month is World No Tobacco Day. So again, just really want to highlight, we chose a very cute, kind of stock graphic. If you use the Canva platform, there is no copyright issues with stock photos. So I do want to put a plug in there for that. So again, we use lots of emojis. We made a reference to the California Quit line, the vaping specific one, really kind of giving students a few resources. We talked a little bit about the quick kits, looping in those emojis. I didn't include hashtags yet, but just wanted to at least give y'all a little bit of an idea. One last thing that I do want to quickly go over, I don't have a specific slide for it, but with working with the current college campus community, I do want to recognize that the students of today, with access to social media, everybody has a phone, internet is expected, and Wi-Fi and all of these things, that there is this sense of immediate gratitude. And so I do, want to encourage you when you're talking to students or you're posting on social media and things like that, to reiterate that message of trying and trying and trying again when quitting tobacco, because students of today, from what I have seen personally, is they expect that they're going to try to quit tobacco and it's going to happen instantaneously. And that's really not the case. We know it can take upwards of, an average of 7 times of attempting to quit in order to successfully quit tobacco. So really, just reiterating that message, letting them know, not to give up, that you're there for them. They have resources available. And their community is supporting them, and it's a community that wants them to be healthy and happy. And that is it for me.
Thanks, Rachel, so much for sharing some of the exciting things that Sac State is doing. I'm sure a lot of the information, especially the social media methods that you guys are using, will be really helpful for some of the other campuses throughout California. So now that we've seen some examples and some ideas of how campuses are working to support students in encouraging and supporting quit attempts during COVID-19, let's take a look at some recommendations for virtual support while college students are doing remote learning. We've heard from some of our students on our COF Student Leadership Board about the ways that they're working on the campus level to support students during COVID-19. One of our student leaders at USC created a tobacco-free club on campus and has been working to find ways to partner with the campus administration to address tobacco concerns at USC. Currently, their student organization is partnering with the USC Pharmacy to work on virtual educational materials and digital materials to educate on the impacts of tobacco use and encourage quit attempts. Messaging will also incorporate mental health and tips for coping with stress and boredom during this time. One thing that they're also looking to implement is more smoking and vaping questions in student surveys with the hopes of getting a better idea if tobacco use among USC students has changed during COVID-19. So we've heard a little bit from Rachel about how they've implemented telehealth and telecounseling. If your campus has a capacity to implement telehealth or telecounseling, this is a great way to provide that one-on-one support during quit attempts virtually while in-person services are not feasible. While individual counseling has been preferred, virtual peer support groups may be an idea to look into if some of the students you work with prefer to speak with peer groups about their use and experiences. If you have the staff and enough students who would be interested in a virtual support group for quitting tobacco, this can be a great way to offer support for students who are quitting or thinking about quitting, as it provides a way for young people to talk with others who may be sharing the same feelings during this time of shelter in place. And they can also share tips on how to cope with stress and boredom or provide peer support in quitting. Utilizing peer health educators or student staff in facilitating or participating these virtual support groups could be something to consider. Another recommendation for resources includes providing quit kits or NRTs and NRTs. If your campus health center or pharmacy is open, you can partner with them to provide quit kits or NRTs if you have the resources. During this time, some options of providing these resources that are, with the CDC guidelines and until it's safe to actually be on campus could include student pickup or mail delivery. Pictured is an example of some of the items that CYAN has previously provided for quit kits, including mints, mint toothpicks, honey sticks, lollipops, gum, our guide to quitting tobacco, a pen, and a notepad for journaling. We do recommend that you customize some of these materials to better suit your campus population. If your campus is unable to provide NRTs, you can always refer the students to the California Smokers Helpline, and they can provide free NRTs. As Caitlin mentioned, that will be mailed directly to the caller. If your campus health center has a social media account, you can use it for virtual education and promotion. Social media posts can be used to educate students by bringing attention to the negative impacts of tobacco use, especially during COVID-19. And encourage quit attempts, as well as providing quit tips and examples of how to deal with stress and boredom during this time. You can see from the digital campaign that we showed earlier that not only were we bringing attention to ways that students can cope, youth and young adults can cope with their stress and anxiety during this time, but also provided a call to action. So providing them a resource that they can use to quit if they're interested. Sometimes students aren't aware that campus health centers offer support to help with quitting tobacco. So social media is a great resource for promoting cessation services that your campus may be offering, especially since students are currently not on campus and may not know that campus health centers are open. You can also partner with other campus organizations and tag them in your social media posts. This would help with spreading the promotion of services and cast a wider net for audiences, since not all students may follow the health center account. If your campus is not currently offering cessation services or is still working on how to implement services, you can always promote available resources that students can use for quitting tobacco, such as CYAN's Quit Tobacco page, the California Smokers Helpline, texting programs, apps, etc. While in-person campus events are canceled or postponed, social media can also be used for virtual student engagement. This is a great way to encourage quit attempts and show that while we may not be physically together, students are not alone. Some examples of upcoming events that your campus can use for virtual days of action include World No Tobacco Day on May 31st or Asian Pacific American Heritage Month, which is this month, May. And that can be used to bring attention to tobacco-related disparities among the API community. Examples of ways to engage students virtually include partnering with campus organizations to participate or creating posts or digital pledge templates that you can share with others to use. You can see on the slide some examples of the social media posts that CYAN created and used for Earth Day 2020. along with the pledge that we provided for youth and young adults to share how they pledge to live tobacco-free for a healthier environment. Now we'll spend this time going over any questions or comments that you all may have. If you have any questions, please submit them in the chat box and we'll answer them accordingly. Okay, so it looks like we don't have any questions at this time, but if you guys do have questions later on, we will provide our contact information at the end of the webinar so you can submit questions afterwards. So we just wanted to share a few updates and opportunities from CYAN as well as our partners. So first, we have an upcoming webinar on May 28th at 2 p.m., Innovative Strategies for Increasing Smoke and Tobacco-Free Policy Compliance on College Campuses. So this webinar will share preliminary data from a UC and CSU campus to go over interventions designed to increase policy compliance on campuses, along with methods for collecting data to show the impact of smoke and tobacco-free policies. We also have an exciting leadership opportunity for college students. Our COF student leaderboard applications are currently open and they're open until May 18th. This is a great statewide leadership opportunity for college students interested in working closely with CYAN staff on specific projects for statewide college tobacco-free efforts. Please share this opportunity with any college students that you know that may be interested in gaining leadership training and experience in the fields of policy advocacy, public health, tobacco control, and community organizing. We also have some exciting updates from our partners. The University of Texas, UT System, and partner institutions are holding a virtual Eliminate Tobacco Use virtual summit on July 16 through 17. Registration is now open and anyone can register. More information can be found on the website shown above. Next, the new vaping prevention resource website offers vaping prevention media research and advocacy resources that you can share with young people that you work with. If you visit www.vapingprevention.org, they do have a media gallery with hundreds of youth-focused vaping prevention and cessation ads, and they also have a cool media rating tool that's fun and easy, and it's a way for students to rate their ads on their effectiveness. Lastly, the Truth Initiative funding opportunity has been extended for May 26th. This opportunity is for their tobacco vape-free college program, and it offers grants up to $20,000 to minority serving institutions, community colleges, and women's colleges to adopt a 100% tobacco and vape-free policy. More information can be found on the Truth Initiative website. So we do, since we have a little bit of time, we do actually have a few more questions. So we have a question about whether this webinar will be recorded. So we will, this webinar is being recorded and we will post it to our website later. We'll also provide instructions on how to access that after the webinar is finished. And it looks like we have a question for Rachel. What was the resource for campus disposal of tobacco products?
So that was a guide from Cal Recycle. It was given in a previous CYAN webinar. It was presented by Alex Bird. I have it saved to my computer drive, so if anybody is interested in getting that resource sent to them, please go ahead and email me. I'm putting my email address in the chat right now. So you should have all seen my email.
Okay, so it does look like we have another question here from Heidi. In regards to NRTs, are there any specific guidelines for vape users? So we refer back to the California Smokers Helpline Guidelines. Gary Tadashi has, and Kim Homer Bagadori here with us, have done great trainings on college cessation services. And there are materials, I believe some of those materials are available on our website. And if not, Heidi, that's something that we can send to you. And I don't know, Rachel, as someone who's working directly with students in a health center and with ATOD, if you have anything else you'd like to add to that.
So when it comes to vaping and NRTs, I know that there's so much variability with the way that students talk about use. So I think kind of one of the first things that I worked on when I first really started having serious conversations with our providers and our pharmacists around vaping and quitting vaping and the use of NRTs was how to talk to students about the frequency of their use. So very much, you know, we have a kind of a general idea of how much nicotine might be in a pod as far as how it relates to, you know, the number of cigarettes in relation. And so really, you know, trying to understand whether or not students are taking one hit or if they consider, like, you know, if a provider was to say, how many times a day do you vape? If they say one time, does that mean one session? Does that mean one hit off their vape? So really kind of changing that language and how they're asking those questions to be more along the lines of, okay, how many of the vaping pods are you going through in a day or in a week? That can help kind of, you know, look so that they can see approximately how many cigarettes worth of nicotine they're going through, and that will help them decide what type of NRT, kind of what dosage and things like that. That can be really helpful for folks, I know.
All right, thank you, Rachel, for elaborating. So we have another question about what the websites are with the flyers and handouts. So on this screen right here, you can see at the bottom our website, CYANonline.org. If you go onto our general rep website, there is a button on the top right-hand page that says Quit Tobacco, and that will lead you to the resource that provides knowledge and tips about quitting, as well as some of the free resources that we had talked about earlier, such as a helpline and the different texting programs and apps. And then in the interest of time, we'll just answer one more question. So we got a question about what's the next effective way to distribute quit kits. So because it's kind of an uncertain time about, you know, like when everyone will be able to return to work safely in person, and kind of what that will look like, we do recommend at this time, either if your pharmacy is open, allowing the option to do an in-person pickup. So maybe a student can order a quit kit online or through email, whatever works best for your campus, and then having them go to the campus directly to pick it up. And then if you have any staff that is on campus and you'd rather mail it to the student directly, that's also a suggestion that we have. But because there's a lot of uncertainty about when everyone will kind of return to work and what that will look like with limited staff, those are two best suggestions that we have. Rachel, did you have anything to add to that?
So we have tossed around the idea of potentially mailing quit kits to students. At this time, at least for the summer months, we are relying more on just, utilizing our pharmacy to distribute our quit kits. We did get notice from our housing department, though, that they will be housing students in the fall. How many students they're going to be housing is still undetermined. And so, with students being in campus housing, which our housing department is across campus from the pharmacy, kind of reducing that barrier of the student having to walk all the way to the pharmacy, even though it's not that far, You know, any time that they can cut out too much walking, the students tend to. So we have talked about potentially placing some quick kits in campus housing, just to, again, like really cut down on the barriers for attaining the quick kits.
Great, thanks for sharing that, Rachel. So in the interest of time, we'll wrap up any questions. If you do have any questions after the webinar, my contact information is there, as well as Caitlin's. She's our outreach coordinator. She was really the person that really took on the social media campaign that we just launched. So she would be a great resource for social media information. And then we also have our phone number and our CYANonline.org website that has our Quit Tobacco page, as well as our CATobaccoFreeColleges.org website, which houses a lot of our college information about adoption, implementation, and enforcement for smoking tobacco-free policies. Thank you all so much for joining our webinar today. Feel free to contact us if you have any questions. And then there is a short evaluation after the survey. If you could please fill that out and provide your feedback, that would be great. Thanks, everyone. Stay safe and healthy.